Welcome back to Montana this morning. The time now is 6:29. We have a Dr. Erica joining us from St. Vincent Healthcare, and we're talking about COVID, of course. That's been the topic of discussion lately, but more specifically, it's cold season right now. People are coming in with colds, but they're having a hard time deciding, is this cold or COVID? So tell us, what can you say about that?
If I could get one message through today, I want people to know that right now, if you have respiratory symptoms and you think you may have a cold or really bad allergies, and you may be thinking, well, I got vaccinated or I had COVID last year, you still need to assume that you have COVID until proven otherwise. You need to mask up, you need to distance yourself from others, and you need to go get a test, because what we are really seeing, obviously, is this huge surge in COVID that you guys have covered extensively on the news and everybody is aware of. But I think that I'm still seeing people in clinic who are coming in mass with the sniffles or congestion or a cough, and they really aren't thinking that they actually have COVID at that point. And we swab them, and sure enough, they have COVID. So we're seeing a lot of this COVID in people, obviously, who are not vaccinated. I tell people, if you're not vaccinated, you can just plan on getting COVID. So you need to decide if you're going to get COVID or if you're going to get vaccinated. But right now, even with people who were vaccinated, we are seeing those breakthrough infections, and we keep saying being vaccinated is what's protecting you from the severe disease in most immunocompetent people. But number one, it's COVID until proven otherwise. So go get tested, call your primary care provider's office, and figure out if you need to be seen in their office or if you just need to go get tested at one of the sites around town. Try to avoid going straight to the ER or the same day care unless you're critically ill or need immediate medical attention.
All right. And, this is the time of year when people who earlier on in the year did get their vaccination. I got mine, in April, so it's been 5 months. Can I get a booster yet, or what is the outlook on that?
So it's a great question. I get it every day. We do know that the vaccines are starting to lose some of their efficacy at about 6 to 8 months in most immunocompetent people, meaning people who have a good immune system. We're starting to see that fade a little bit, but it's still protective at that point. So yes, at some point we will be seeing those boosters coming out for those people. But those who really need to listen right now are those who are immunocompromised. So if they have some disease or illness that is making their immune system not work well, or if they're getting chemotherapy, or they're on certain medications that suppress their immune system, a lot of medicines for rheumatoid arthritis or multiple sclerosis or other autoimmune conditions, those folks, they need to get their third shot now. So at least 28 days after their second shot. So they don't have to wait that 6 to 8 months. If they have one of those diseases, then their response to the first shots probably wasn't adequate, and they just need that third shot. So go in and get that third shot as soon as possible to make sure that your immune system is good. And keep in mind, if you were immunosuppressed last year when you got the shots, but you're not now, you still may need that third shot.
And let's finish up when talking about the kids under 11 years old. What's the outlook on getting them vaccinated?
The $1 million question, which is big in my family. Both my kids are 11 and under. So exciting news. Pfizer is about ready to submit all of their data. They think they have sufficient data that they'll be able to submit at the end of this month to the FDA for emergency use authorization, which means we may be able to see vaccinations in October for some of these kids 5 to 11. Moderna is about a month behind them. Pfizer also said that they do have data as well for the kids 4 and under, and that will probably be about a month behind them. And Moderna thinks that they're going to have enough data by the end of this year for those age groups as well. So keep your eye on your provider's office and on the news for those kids 11 and under. Hopefully we get those shots for them in the next month or so.
Yeah, right now it's kind of like walking on eggshells. Just try to keep your kid healthy and safe. So there'll be some relief ahead. Thank you so much, Dr. Erica, for your time. I appreciate it, and you have a great rest of your day.
I will. Stay safe.
Thank you. We'll be right back after this.